Okay, so some tips for expectant mothers when it comes to home care. One of the most important things I would stress is that you really want to keep up on your hygiene at home as far as your brushing and flossing. The main reason being that when a woman is pregnant, her body is going through all these hormonal changes that can make the body more sensitive to the bacteria in the plaque that's in the mouth. So by increasing the brushing and flossing, it's going to help kind of protect that patient or protect that mom from possibly pregnancy gingivitis, sore gums, bleeding gums, tenderness, things like that. Another thing to keep in mind is some women complain that they can no longer brush without gagging, sensitivity to the toothbrush, things like that. So an easy tip for that would be to switch to a smaller toothbrush. So if you're normally using an adult-sized toothbrush, but now you're really struggling with that, maybe you just are nauseous easily, try switching to a child-sized toothbrush. Speaking of the nausea and morning sickness that a lot of expectant mothers battle, another thing I would caution people about is if you are experiencing that morning sickness and throwing up, right away, most people want to brush their teeth, but I would caution you to wait a good 15 to 20 minutes after throwing up. The reason being is after you've gotten sick like that, the mouth is more acidic, and that acidic saliva, if you go in and brush right away and brush that all over your teeth, that can erode the enamel, making the teeth more sensitive, making you more prone to cavities. So what you really need to do, anybody after getting sick like that, should really rinse with some water. Give it 15 to 20 minutes for that mouth to become a little bit less acidic, more basic. Then you can go back in and brush and floss real regularly. Probably the other tip I would say is just don't put off your dental visits. A lot of pregnant women stop coming in. They think that they can't come and see the dentist. And, for most women, it's completely safe to come in. And if anything, we really recommend it so that we can keep an eye on things, make sure that we're helping the patient keep things really clean, and also help maybe prevent things from getting any worse. If a patient comes in and is struggling with the brushing and flossing or is having some sensitivity because of all the morning sickness, we can then give them some tips and maybe recommend some products